Welcome to the Edelheit Experience, a compelling conversation about revolutionizing health and well-being, bringing you rich stories and lessons learned from leading corporate executives. Now, we'd like to introduce your host, Jonathan Edelheit.
Thank you for everyone for joining us today on the Edelheit Experience. I have Mark and Stephanie with me. Thanks for joining us.
Thanks, Jonathan. Good to see you.
And I'm Heather. Nice to see you.
So Heather and Mark, introduce, it'd be great, to share with our listeners. Tell us a little bit about yourself.
Good. Heather, you can go first.
So hi, Jonathan. I'm Heather O'Neill. I'm the Director of Physician Recruitment and Organic Growth Strategies here at the ARSA Network. I've been with our founding practice, the Plastic Surgery Center, for just a little over 15 years now, and have covered all different departments and operations from intake to revenue cycle management, marketing. But one thing I hold near and dear to my heart is our international program, as Mark has shared in another conversation that I have been close to the beginning of this program developing, and look forward to talking more about it.
Great. And I'm Mark Donati. I'm the Chief Operating Officer for ARSA. I joined just shortly after ARSA's formation. We just had our third birthday or third anniversary. It actually started in August of 2021. And I came aboard as the executive team was being formed. So I've been working in operations since then, building a team as we've been bringing on our pillar practices around the country and helping to integrate them into the ARSA network, helping the operations at all of the locations, come aboard. We offer this, suite of support services that any of the pillars can kind of tap into at any time. Everything from, marketing, revenue cycle support, help them grow their specialty program development, IT, HR, whatever any of our pillars need support with. We have expertise here in basically what we call our home office, our corporate office. So my role is to assure that we're doing everything we can to support our pillars and grow our programs.
And what's the scope of, your group of, physicians, practices, specialties? Because for those who are listening, they may be like, 3 years, they're a startup, but you're, like in that concept that you are, but not from the underlying medical practices.
Correct. I mean, just as I mentioned, I've been with the Plastic Surgery Center, or the Institute for Advanced Reconstruction, for just a little over 15 years. And that's been the foundation of our network. That the scope of those practices are everything from your standard plastic and reconstructive procedures that plastic surgeons are known for. We do a lot of complex microsurgery, peripheral nerve reconstruction, breast reconstruction, and a lot of things for complex conditions, diseases, and injuries. So it's a broad scope. We have 8 different practices across multiple states right now throughout the ARSA network, and a total of about 89 surgeons within our network.
That's a lot of surgeons.
Yeah, what's interesting, when the Plastic Surgery Center was chosen, let's just say as the foundation for ARSA, it was already such a well-developed and large. It is the largest plastic surgery group in the United States. So it already had such kind of depth and breadth of service that it was already a very large entity. And the reason why I think our investor group decided to make it the anchor tenant, so to speak, it already had such a built-in back office because of its complexity of services, both in and out of network with insurance companies. So it had a back office, a fully developed revenue cycle, legal teams, insurance teams, et cetera, that it had the infrastructure to be able to support this kind of growth of practice. So by the time 3 years later, and adding on 7 more practices and another 30, 40, 50 surgeons, ARSA's network is already very big, and it's the only one like it in the country. So, which makes it also very unique and interesting. And we have practices that solely focus on breast reconstruction, and we have those that are a little more diversified, like the Plastic Surgery Center and our Vanguard group in South Florida, which does, a much more wider variety of type of procedures. So, we have this unique mix of specialties across the platform, which is very interesting. And one of Dr. Elkwood, who's our founding, CEO and surgeon, one of his major mantras is this kind of cross-pollination of clinical practice. And he's so excited about surgeons teaching surgeons, techniques and specialties. Everyone has the hands, and the intellect to be able to do so many types of procedures that just because, and I hate to say this, just because you've only done breast reconstruction, like I know what that is, how to do it, just because you've been a breast reconstructive surgeon for so long doesn't mean you can't venture outside the chest cavity, right? And because you have the skill and intellect to do more, what excites you? Because we have experts in our network who could teach you how to do other things, So he's pushed very hard, and we have physicians fly from one practice to another and observe new procedures and take them back home and begin to get excited about expanding their scope of practice. We do cadaver labs. We'll have cadaver labs right here in New Jersey, and we'll have doctors fly in and dissect different new parts of the body for them, and dissect a nerve area. It could be groin, upper extremity, lower extremity. It could be head and neck, and really teach and learn even well into someone's career. And that's what I think is exciting about, and the term we love to use, I think Dr. Elkwood takes credit for it. I don't know if it is his or not, but we use the term private-demic. So there is a very academic atmosphere in this private practice environment that we have. So there's still a lot of teaching, and there's a lot of academic pursuit and interest among our surgeons, which is really cool. And we have our own research team. We have an IRB. We have a medical illustrator. So we're constantly, doing research, and we're publishing, and we have this kind of atmosphere of learning, which is really interesting. It's rare to see that in a private practice. You'll see that in academic medicine and academic medical centers. But I think that atmosphere here really kind of keeps everyone excited about their clinical kind of journey and evolution, even well into their mid and later career.
I would say it sounds exciting, like when you're at a practice that's like constantly pioneering and, not just saying this is the same thing we're always going to do, but kind of like the envelope and publishing the research and inviting doctors, for that on-hands training. How difficult is that to actually do? Like to be the ones pioneering the surgeries, publishing the research, doing those things. Because I know you say you're unusual in that you do that, and you're one of the few in the country. I assume that's a lot of work to manage.
Heather, you've been here through a lot of that.
Yeah. Well, as Mark mentioned, we coin ourselves as being private-demic because we have the ability to carry through on all of those academic style resources. Our physicians, when we were a smaller private practice group to our ARSA network now, we continuously hold journal clubs, cadaver labs, as Mark mentioned. We have annual summit meetings with all of our ARSA physicians to cross-pollinate and innovate, whether it's augmenting an existing technique or procedure that's currently out there, or pioneering new techniques to provide greater access to care for our patients. So in terms of difficulty or challenges in getting that across, we've actually, with the resources that we have throughout the ARSA network and the great group of surgeons that we have a physician portal where all of our physicians communicate, have access to all of this information to do things like journal club, M&M, second opinions, and all of those things that allow our physicians to really learn and teach and put their heads together to innovate and pioneer some new techniques or procedures.
One of the things we're doing now for the new grads, so we're getting, as surgeons are coming out of training and they've decided to come and join one of our practices, before they even start, we're introducing them to specialty procedures. So they know they want to kind of specialize in a certain area of reconstructive plastics, whether it's breast recon, hand, upper extremity, general plastics. But what we're doing is we did it with this incoming class this year, is try to get them in a little early towards the end of their fellowship, bring them here to New Jersey and expose them and have them participate in some specialty program surgeries, and then get them excited about something they may want to even subspecialize in it when they join their practice in San Antonio or in Ohio or in Louisiana. And then they now have a way to bring that into their new practice. And they're now the specialist for that as they kind of grow into their new practice, as a new plastic surgeon. So I think that was kind of a really sharp idea. And I know that, Heather and a few others here really facilitated that this year. And I think that's going to make a huge difference.
No, that's great. It seems like you're very open about teaching, right? Where I think some doctors who practices don't want other people to know what they're doing or their techniques. Is what opportunities are there for doctors or hospitals, around the world to potentially affiliate or partner with ARSA?
So it's a great opportunity for physicians, whether they're existing providers and institutions here in the States or globally. One of our surgeons recently went over to Spain and taught several surgeons on the phrenic nerve procedure and implanting the diaphragmatic pacing device. So we are open to teaching as well as physicians from all over the world to come in and learn.
We'd love to. I think this is the first year. We talked a little bit about this just last night, ironically, about our spring summit, which is our, internal conference, our medical conference, and beginning to open this up to international guests and other surgeons who would like to come and either present or, be audience participants and actually sit in and begin to understand and take back to their home countries, understanding of the techniques that we can do, which will then obviously cultivate the ability for patients in those countries to access care that they've never had access to before. And, working with you, Jonathan, that's been our goal for the last 2 years, is really providing access pathways for patients to be able to find us and to come here to the United States and get that care. You've been very helpful in helping us develop this affiliate program, which we're right on the doorstep to launching, I think, in the next week or two, which will help define a way for surgeons in other countries to link themselves to ARSA, in an informal but semi-formal way to be able to actually present cases to us, for consult, second opinions, participate even potentially in some research or paper writing together, depending on the topic. And I think we'll start to link this network together across continents. And I think it'll really be revolutionary in the reconstructive world.
And it's not easy to put something like that together, right? Because you have to have, I feel, something really well thought out, and that's going to be beneficial to both parties. The doctor abroad, there needs to be value. There has to be value for ARSA, but you also have to be careful in who you choose. Right. Because at the end of the day, you want everything to be successful. What are some of the complex procedures that maybe people aren't aware, that ARSA on a global basis is doing that's very unique to your practice?
So I think to start off with, phrenic nerve reconstruction is one of them. Dr. Kaufman in our group is one of the only surgeons that offer this type of complex peripheral nerve reconstruction. That phrenic nerve impacts the diaphragm muscle, allowing patients to breathe. Another procedure that we offer is for people that have pudendal nerve entrapment that creates a great deal of pain and discomfort in the pelvic area for both men and women due to common things like childbirth and cycling and things of that nature that aren't readily available in all areas, and even large institutions here in the U.S. may not have the ability to provide those solutions for people with chronic pelvic pain due to pudendal nerve entrapment, piriformis syndrome.
That was pioneered here by our doctor.
Correct. Yeah. As well as the phrenic nerve procedure. And then, we are on the horizon of launching our national and international lymphatic program with world-renowned physician, Dr. Joseph Diane, who has recently joined the ARSA network to provide solutions for lymphedema. He's trained globally over the years and is bringing his expertise to our network to provide those access points for all of those patients globally. So there's a lot of unique, solutions that we can provide to patients. And that's just the tip of the iceberg there with just naming those 3 programs. We have over 35 specialty programs that we foster, that all of our providers lend to providing that care to patients that are otherwise told that nothing else could be done, or they've gotten so far. And so I really, I go back to the beginning when I was here and really just being able to provide hope to the hopeless.
When you talk about the hope to the hopeless, so for the doctors, I'm assuming who are on here, like phrenic nerve, pudendal neuralgia, like they may understand that. For the layman on there, like what could patients, maybe injuries they have sustained or things they're experiencing where maybe they don't even know that this even exists, like there's a surgery for their underlying problem. So maybe you could share some of that, and maybe even some of the patient stories.
Sure. So, for instance, for phrenic nerve diaphragm paralysis, patients may experience shortness of breath by bending over to tie their shoe or climbing up a flight of stairs or something simple as going out to the mailbox to retrieve your mail. They'll notice a shortness of breath, and that could be following a surgery. It could be following an injury that they sustained. It could be following, a medical treatment that they had, and they notice it. And so they may relate that to symptoms of having some type of cardiac or heart condition. And most of the time they'll present at the emergency room with that shortness of breath, and they get worked up and cardiology says, nope, you're okay. They may have an image and it shows that their diaphragm is paralyzed or it's elevated. And so most times those patients are told that they can go seek additional treatment that could involve surgery, or they could potentially live with one diaphragm being paralyzed or elevated, and that they would just have to make accommodations with some breathing assistant devices like a CPAP or a BiPAP to sleep at night, which is that little mask that they wear at night. And some patients are just left with that and figure they just have to manage that shortness of breath going forward until they find solutions like our institute here. Pelvic pain, somewhat the similar thing. I personally belong to a lot of those groups on social media. And so I see the patients that are suffering with chronic pelvic pain due to childbirth, long-term cycling. They could have had an injury or another procedure or something of that nature. And unfortunately, when the body's healing, sometimes those nerves get tangled up in different places. And they've gone through all conservative measures, whether they've gone to physical therapy, they've had pain medication, they've had injections done, they've had adjustments done, etc. And they're still living with this chronic pain. And their providers back home may say, there's nothing else I could do. We've tried it all. And then they're left hopeless, right? And they're either on these social group chats asking, like, what are your symptoms? Who have you seen? Who's cured you? And then they find our surgeons as those solutions. That's how a lot of our patients will find us, is through there, plus with our physicians going to conference and doing medical lectures to other medical professionals to let them know about these solutions for patients. So there's the two-pronged approach and how patients find us. With regards to a patient success story, One particular sticks out in mind. This was a recent patient. She's from a South American country, and she's a teacher. She actually teaches those children English as a second language. And she was in an accident in that country, and she suffered what's called foot drop. So the nerves and the tendons in her lower extremity were stretched due to this injury, and she went to a multitude of physicians there in her country that unfortunately did what they could. They put her in a brace, but she suffers tremendously in not being able to raise her foot and walk correctly. She needed assistance because she had this foot drop. And unfortunately, there wasn't any specialist there. So she came here and had surgery with one of our surgeons, Dr. Michael Rose, who specializes in that here at the Institute, actually just a few weeks ago. And she's back in her country and doing well and teaching those kids. And we're expecting a full recovery.
That's great. With a couple of things I like, Jonathan, are relate to paralysis, and just that personally, I'm a nurse by background, and I worked with spinal cord injured patients early in my career. And, there are a number of different paralyses that patients obviously can have due to stroke, injury. Facial paralysis occurs sometimes due to, it could be even infection or other reasons. And we have a couple surgeons who've been able to develop techniques to help with some of those, paralytic conditions. Even just from a quality of life, improvement, it's tremendous. A lot of times when patients have a stroke and they lose loss of function in a limb, it's usually like, okay, you go to rehab and you live with it. If a patient can get movement back in fingers, even thumb and forefinger, or they get hand movement back, or the ability to lift their arm, at least parallel, it's tremendous, quality of life improvement. So, some of our physicians, depending on the injury and the level, et cetera, if we can perform that surgery and bring that functional level back, it makes such a huge difference. And we've been able to do that, countless times. So it's just, again, patients knowing about this and finding us. And we can't help everyone because there are a number of factors that, determine if a patient's, right for that kind of surgery. But when we're able to help, it's so rewarding. And we love that stuff. So that's why we come to work.
That's right.
I don't even do the surgery, but that's why I come to work.
I know. Exactly.
Yeah.
So, I know that, your group is specializing in these micro nerve surgeries. Why is it that a lot of the docs in other specialties don't even touch that?
A great question.
It's probably the amount of training, that goes into that during their fellowship years. I mean, you have to love it. You have to train in micro. And let's just say if you're an orthopedic surgeon, you're not going that route, right? So Dr. Elkwood says that, microsurgeons really are the surgeons for every specialty because they could fit in everywhere in the body, right? And they fill those gaps that those other specialists just don't have that level of training with. We have oculoplastic surgeons, they do work on the eyes. We currently have a few of our physicians doing, occipital lobe, so on the back of the brain, nerve work for certain migraine type conditions. So that's very highly specialized. So you say, well, why aren't neurologists doing that or neurosurgeons doing that? It's just, I don't know. I can't say why they didn't train in that, but it's all based on that kind of nerve pathway work that I guess the microsurgeons have kind of focused on in their training and in their whole professional lives. So, if it's there and it's injured or insulted, our physicians will find a way to repair it and make it better. So I think that's the exciting part. And from this international perspective, and even domestically, I mean, we have the same challenges domestically.
Right.
We're trying to have folks understand that, we're here for them. And certainly in the ARSA network, we're not, for this podcast, I feel like we're ignoring all the other great work that some of our practices do. I mean, if you think about the breast reconstruction we do as a collective, ARSA does more, autologous, flap reconstruction than everyone else in the country, So, we're doing probably 2,500 to 3,000 autologous breast flap reconstructions a year at ARSA, which is, a preferred breast reconstruction technique, which again requires that training and that level of microsurgical training for breast reconstruction. Now, that's not something that patients are necessarily going to travel from another country for, but in the United States, people are traveling to those centers for that. So for years, people have been traveling to our center in New Orleans and our center in San Antonio in Ohio, specifically for breast reconstruction, because those physicians trained and have that reputation to be able to do that work that others, a few others are able to do at that level of expertise.
From an infrastructure, area, maybe you can share your infrastructure from, I feel like you've got an amazing engine that you built, right? Whether it's marketing, patient experience, dealing with the patients, maybe you could share a little bit about kind of that, and also like how you service, patients and that specialized service that you have. Because I feel like a lot of practices, what you guys are doing volume, but you've built a very strong foundation on it to really support all the growth that you're having.
Yeah, so patient experience and safety are our number one priorities here, regardless of the zip code that they're going to be traveling to or where they're coming from, for that matter. So our infrastructure is really based around our patients, again, their safety and their experience. The marketing component, that's through various channels, whether we do digital marketing, whether we do direct-to-patient marketing, physician-to-physician marketing, to educate them on the different solutions that we have for a lot of these conditions, diseases, and injuries that our physicians can help with surgical intervention. And then, in terms of internal infrastructure, as I mentioned earlier, regardless of where that patient is coming from, we ensure that they have the best experience when they either connect with one of our patient ambassadors, all the way to the day that they check in, to they leave our facility and return home, whether that's here in New Jersey or one of our pillar practice sites, or another state or another country.
And everything I think maybe you're asking is also, we have everything they need, right? So we have financial counseling, we have, revenue cycle support, we have everything the patient needs, once they get into the system. And then we also have all that support to continue to try to make sure that the patients know we're here, and then the whole other piece is, how do we support our physicians and their practices to make sure that they have everything they need, to continue to flourish and grow? I mean, they joined ARSA so that they can concentrate on their medical work, and we can help with everything behind them to help their practices grow and take their mind off a lot of the business aspects of their day-to-day work.
For your patients in New Jersey, you guys are utilizing Jersey Shore Hospital for some of the procedures.
Mm-hmm. Yeah, so for a lot of our complex nerve reconstructive surgeries, we do utilize Jersey Shore University Medical Center, part of Hackensack Meridian Health. That's one of our flagship hospitals where we have a dedicated nerve center for a lot of these specialized procedures. We also have our Institute for Advanced Reconstruction, where we have our own independent surgical center that's also able to support some of the outpatient surgeries that we offer here at the Institute, as well as we have our St. Charles Surgical Hospital down in New Orleans. I know you asked about New Jersey, but we also have affiliations in these other states where our ARSA pillars are. And St. Charles Surgical Hospital is one of the only microsurgical hospitals in the nation. And if you've ever never been there, it's nicer than the Ritz-Carlton. It's gorgeous. But we also have affiliations with other hospitals and our own independent ASCs that a lot of our pillar practices have affiliations with or ownership in.
Yep. My Houston surgeons, our group in Houston has, their own, 2-room ambulatory surgery center right inside their practice. So that's a huge convenience for patients getting breast reconstruction or other surgeries in that location. So that, that's a great convenience for patients as well. But I think you can mention, and you're well read into this, Jonathan, with Jersey Shore Medical Center just got their, medical tourism accreditation. So they're now fully accredited for patients coming in for, this microsurgical, the microsurgical procedures for patients coming out from outside the country. So it's a great partnership for us.
No, it's nice to see them go through that global healthcare accreditation and be committed to, the business that you're growing and that you're specializing in. Are there other specialties in the future that you're looking to expand in? And I think you said you had 89 docs right now. It could be, hopefully I'm right with that number, but where are you going to be a year or two from now? Any idea?
Well over 100. I'm sure of it. We have, partnerships on the horizon that will be joining ARSA, as well as I mentioned at the top of our call here, that, I'm physician recruitment is my main priority. So I'm hiring physicians for all of our pillar practices. So I see our network expanding definitely in the hundreds with the provider count. And being able to offer, service lines that expand our general plastic and reconstructive surgery, as well as our breast reconstruction that Mark was mentioning, oculoplastics, general and breast surgery, even for patients that are diagnosed with breast cancer or other types as well as some other adjacencies.
I think you mentioned before, Heather, I think the largest potential impact for us to have is through building out the lymphedema program.
Yes.
Just given our patient population across the United States, at least, and, the expertise we have in the practice now and the need across, the network, I think we can have a huge impact over the next 3 to 5 years, on the healthcare community that way.
So I know you were one of the first to kind of join in Better by MTA, our launch of our new platform with Mastercard. I was excited to have you participate because you guys are just doing innovative things that nobody else is doing out there in the world, and offer some very unique services that I think that patients need. What value do you see in joining that? What do you think the benefits are for the industry on the international patient side as kind of, Mastercard and MTA launch this new platform?
Yeah, there's probably a few benefits. I just think it creates a huge highway, a huge pathway, easier pathway for patients to end up finding care, right? Just, the brand recognition for Mastercard now leading to these very high-end providers of care, I think is going to open up the world, the access to, levels of care that other parts of the world probably never had before. And I think probably, Heather, from a payment perspective, which you get intimately involved in for all of our international patients, you probably can see some benefit.
I do, and I didn't mean to cut you off, Mark, but yes, I think just the ease and the comfort to the patient and the convenience for them as well, with transacting either, payment processing, helping them identify trusted providers in other areas of the world. Just think about if you had to travel to another country for medical care, you're going into a foreign place with people that you may have met over a Zoom call or, something of that nature. So I think it just provides that extra level of ease and comfort to the patient, and really looking forward to this venture with your company.
Yeah, we were excited. I mean, most of the kind of the beta group we're institutions, and we're really a collective of practices, here in the US. So we were kind of excited to be a little different from everybody else, but be part of this kind of launch team, we thought was very unique for us.
One thing I'm curious about is, have you noticed over the years how that like has it changed how patients maybe search or choose the surgeons they're looking for? And is it or is it the same as it was 10 years ago?
That's a great question. Just because I've been close to the MTA now for just about my entire career here, I think it's somewhat the same, just a little bit different, because as technology has advanced and, we have all this AI and Google searches that make it a little bit easier for patients, I find that it may be easier to a degree for them to find care. I think, just again, going back to an earlier point in conversation with Jersey Shore being GHA accredited, having that partnership with the Institute here for Advanced Reconstruction, I think that has helped, because it just creates that trust for patients to know that they're in great hands by coming to one of our institutions.
What and one of the distinctions I make in my mind, and I'm going to be maybe a little biased here, but in the old days, you'd search by kind of institutional reputation, right? And I'm not going to, maybe you'd look for a certain clinic, that you'd know a name of, right? But when you would go there, you might be going to a certain department at that location. You might not necessarily know which doctor you're going to get, right? But when you come to ARSA, you're finding the physician. You're here, you're searching for and when you search, you're finding a physician. You're finding Dr. Kaufman, or you're finding Dr. Elkwood. When you come here, that's who you're getting. And I think that's the difference between when you come to ARSA, you're coming to the physician that you've sought out and is the expert, and that's who you're coming to see, and that's who you're getting. And I think that's really a really kind of cool aspect. Because I know a lot of times when you end up in academic medical centers, you end up in a department and you might be with the new person in that department under the chair of a very prestigious person, which is great, but it's not necessarily the same. So I think that's a little bit different that we can offer.
Definitely. Took the words right out of my mouth, Mark.
And I know what you mean. I think it was a couple of years ago, I had a family member getting a surgery, and it was really one of the top docs in the country in that area. And it was like the day before the surgery, it was like, well, this person's going to be the one doing it, and I'll be supervising. And I was like, no. Come all the way here, right? Across the US, we want you to do it. And I think that's one thing that another reason I asked that question is I find it very challenging, to try to necessarily find the best doctor. I feel like it's harder now than it was before. When you find it, then yes, it can seem obvious, right? Like, oh, this is the person. But when I look at here in Florida, when I look for docs, there's so many doctors that you look at, and they came from international medical schools, right? And I feel like it's almost 90% are doctors. And then you filter down, and you got to look out where did they go to medical school? Was this a good medical school? Where did they where did they do internships? All these different things. And I feel like it's difficult for the average person to even know to look for these things. And then at our hospitals, you're seeing that too, right? And you're seeing where they're bringing people from all around the world, right? And you assume I'm going to this hospital, they're a good local hospital, the doctor there is going to be good in this category, when they may not be. And or you get referred from one doctor to a specialist, and that specialist may not be good. And I think that people need to really do their education and be able to question their doctor who's making referral, or ask those hard questions to go to the best. Because when you said your Louisiana facilities doing thousands of the flap
reconstructions, yeah.
breast reconstruction flap surgeries. It's like, yeah, like those are the doctors you want. Like, you don't want the guy doing 10 per year or 20 per year, because those are the ones that are going to usually have really great outcomes and all the services in place. And I look at it as a challenge going forward for patients around the country. Like, I feel it's going to be tougher and tougher, to identify that, because 20 years ago, I didn't have that problem. Like 20 years ago, it's like, oh, like I can go find the guy who went to Harvard, or I can go find the guy who went to Yale in these different specialties. Now I find like I've got to take a tremendous amount of time, and I might not even find those.
Sure.
So I just wish there was better education to patients about, search well and travel, because this stuff matters to you. Because we have family members that, maybe they live in a certain city, right? And they never leave that city. And then they're like, this is the hospital they've always gone to. So when something happens, they're like, I'm just going to go to this hospital, when people need to really look at where are the best surgeons and be willing to travel, because your health, your longevity, your outcome is going to be related to going to the best.
Exactly.
Yeah.
It's a good point for sure. The only, not to switch topics, but I was thinking about our network most recently, and I think our geography and the way we're kind of spanning right now is really important, because I think about our practice in Fort Lauderdale, Miami area now, and Dr. Dreser having his actual professional connections in South America. I think that's opening up new pathways for patients to be able to access care in Southeast US, which we never had before. And he has professional linkages into Central and South America. So I think that's really cool. Dr. Boutros in Houston, also close to Mexico and Latin America, I think he has a number of connections. So I think even the way we're kind of coincidentally building our network is just even geographically opening up some pathways that didn't exist even in our first couple of years as being ARSA. So I think that's going to be helpful for patients as well.
Yeah, absolutely.
Oh, sorry to interrupt you. And going back to the social media platform that we talked about earlier, the patients talk. Jonathan, you mentioned earlier about how physicians referring to specialists and, the doctors knowing the doctors, but are they really good? And what's their expertise? It's now on that personal level. We do it when we go to restaurants, right? We check them out. We check them out on Yelp and other sites to see how they were rated, what people are saying about the food that they ate. Well, people are doing that with physicians too, right? If they have a specialty condition, a lot of patients are looking on YouTube. They're looking on these different social platforms to see if they can make a connection with somebody that has similar symptoms or a diagnosis, to see how they fared. I mentioned earlier in our call how I belong to a lot of these social groups, and I see that firsthand. What are your symptoms? Who helped you? What was the outcome? What was your experience like? And I think that's providing ease of access to the specialists, whether it's in plastic and reconstructive surgery like we offer here, or any discipline really. Patients are connecting on different platforms to see who is the best of the best, and also considering those recommendations from their providers and or things that they've researched on the internet.
What do you think are the most effective platforms that patients should be using maybe to do that research?
Well, for one, you always want to check out and make sure that your physician that you're going to be seeing is either board certified in their field, and they're qualified surgeons. So there's a ton of medical board type of sites that the patients can go and check out the credentials of that surgeon that they would be being treated by. But I also think that effectively is the social media. That's what they're going to see, between patients and see real life stories and patient testimonials of what their experiences were going in. So I think, social platforms are very effective. I think, your common Google search is very effective, but spend some time on that provider site and see what kind of information that they're providing to not only the patients, but and they're very informative. So everything is clearly laid out for the patient.
Are you doing anything with TikTok, or is that,
So funny that you say that. We have we have some plans to go on TikTok, but moreover, some of our patients have started their own TikToks or have enhanced their own TikToks. And one surgeon, particularly here in our New Jersey clinic, has seen an uptick because of TikTok. For pudendal neuralgia, actually, because, a patient of his has posted her story on TikTok. And so we've received quite a few referrals from the TikTok space.
We actually have two of the physicians in Houston use TikTok pretty extensively for both their cosmetic, and I think it's one of the ENT physicians in that group. And they get a lot of referrals through that methodology because it's a younger patient population that they see. So it syncs up nicely for them. So it's kind of interesting.
It is.
I think Mark should be the one to lead the TikTok initiative, and it should just be
Yes.
Mark, the TikTok influencer, and it's him posting videos.
That would be fantastic.
That would be bad for business.
Well, thank you both for joining us. I really appreciate it.
No, we enjoyed it. Thank you, Jonathan.
Thank you for tuning in to this episode of the Edelheit Experience. If you're enjoying the show, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. We appreciate that effort, and we'll catch you in the next episode.